All right, thank you everyone for joining us today for our discussion today. The format that we're going to take is that we have four great speakers. The topic that we're covering today is best practices in launching telehealth during COVID-19, a panel discussion. I want to encourage everyone, if there's any questions, feel free to use the chat on the bottom to ask any questions. We'll be picking up questions throughout the session. And hopefully provide you some helpful information. So we're going to get started. I want to introduce our panelists here. We have Dr. Anne-Marie Balkanski. Dr. Anne-Marie Balkanski, she's our Chief Utilization Review Officer at Niznik Behavioral Health. She is a MD. Working at NBH, Dr. Balkanski has been integral to the collaboration, trainings, and program documentation development, which helped shape the current business model. As the Chief Utilization Review Officer, she leads a dedicated team in obtaining coverage for all Niznik Behavioral Health facilities. We also have here Jared Hirsch. Jared is the Chief Legal Officer at Niznik Behavioral Health. Jared Hirsch is the Legal Officer and Compliance Officer here, having earned his JD from Nova Southeastern University and his Bachelor's in Business Management from Michigan State University. Jared has overseen the implementation of compliance, protocols, procedures, and best practices as it relates to adjusting to COVID-19 and the telehealth landscape. Coupling his passion for healthcare, parity, and access to treatment, Jared has been an active advocate in ensuring we are able to treat as many individuals in need as we can. Andrea Horwitz, our licensed clinical social worker, clinical director at Harbor Village, a Niznik Behavioral Health facility. Andrea Horwitz is a graduate of Barry University with over 20 years of experience in the recovery industry. Andrea is instrumental to the full continuum of care for clients, providing structured guidance in the implementation of treatment modalities and adherence to protocol for the behavioral healthcare staff. And we also have another Andrea Baskin, MS licensed mental health counselor. She's the clinical director at Safe Landing, the adolescent teen treatment facility, also in the Niznik Behavioral Health Center. Andrea Baskin has over 10 years of experience working with various populations, and she offers families direct support and guidance through the recovery and treatment process. And I'm the Chief Marketing Officer at Niznik Behavioral Health, so I'll be your moderator for today. So welcome everyone again, and thank you all for joining me. I wanted to start off by maybe talking a little bit about the access to care, and want to start off by with you, Jared. What are some of the gaps in behavioral healthcare today, and why did NBH start doing telehealth?
Yeah, thanks, Eric, for the introduction, and want to welcome everybody joining on their late lunch break. So I think when we talk about gaps in behavioral healthcare, we can probably make that a webinar in and of itself. But historically, we're looking at access to care, right? And before COVID, we're confined to really a 30-mile radius when we're seeking treatment. So what we've seen a shift in since COVID really started affecting us is we're looking at waivers that allow us to treat across state borders. So we saw the federal government, we saw CMS really eliminate all barriers to treatment. The problem is we're lacking parity across states and across insurance providers. So currently, the regulatory landscape, we have 24 states that are allowing cross-practice of medicine across counseling services, practitioners, psychiatry, mental health counselors, therapists. But we lack parity in our state licensure boards, in the insurance companies. So really navigating those waters, I think, is the biggest gap that we're seeing today. Where I think we really need to spend a lot of our time is juxtaposing the federal regulations and state regulations. We're seeing a lot of states allow waivers, allow our providers for NBH. At NBH, for example, we can practice in 38 states. We need to really get insurance companies on board. We need to look at waivers really across borders. I would say right now, that's probably where we're seeing the most gaps. It's a parity issue.
Got it. And then, a little bit maybe from you, Dr. Balkanski, why did maybe NBH start the telehealth and some of the things that you've been working with here to help launch telehealth?
Yeah, there was definitely a huge need, obviously, after the quarantine hit and everybody went into their own silos. So we essentially, for our current clients that we had, we needed to fill a need immediately. So that's why we, of course, went into telehealth, the telehealth platform.
Got it. And, launching telehealth, for anyone, and even during this time, especially at all of our centers, I know was a big undertaking. What are maybe some of NBH's best practices for launching telehealth for anyone out there that wants to do this as well?
Yeah, I mean, the quality of care did not change at all. We kept our standards, which we hold pretty high already. We've been doing this for a while, treating mental health, substance abuse clients. The only thing that really took effect was the telehealth platforms that we needed to acquire. So just in order to keep with the best standards, we had to have the technology there. We had to have the video, the audio, the streaming capabilities. We needed to assure that our clients, as well as our staff members, were able to easily access those platforms. So that was one of the main things that we had to acquire to keep up with the best standards.
And what are maybe some technologies that are being used to help us accomplish that?
Yeah, right now we have three main platforms that we utilize. We do have an EMR system, which is pretty established within all of our locations. But at the time, it did not have a full integrated EMR telehealth platform, meaning video. So being that another facility did have Zoom access and they were already doing some telehealth stuff, we kind of just overtook that side and we started using Zoom telehealth or healthcare, which of course is HIPAA, and we have BAA, and then we also utilize a scheduling platform, which is called Acuity. And that really helped us to kind of streamline the whole process.
Got it. So what I'm hearing is, Acuity for our scheduling, Zoom for our video, and Opus Behavioral for our EMR that also helps integrate with some of these platforms out there to streamline the process all from like a beginning to scheduling to a full end solution.
Yeah, and also to add in our Opus, one of the biggest struggles was our clients are remote, so we needed to make sure we had a good e-signing option. So our Opus EMR system does have e-signing in there. So that's all integrated in our EHR. So we use those three platforms to be able to do everything remotely.
Got it. Awesome. And want to go with you, Andrea Horwitz, since you're dealing very, very closely with a lot of clients out there directly. What are some of the best practices that helped you in launching telehealth within your clients and practice?
Sure. Thanks, Eric. So our treatment stays very consistent with our code of ethics, that of a licensed therapist. We definitely respect clients' self-determination. And we're definitely, as Dr. Balkanski said, really supporting this new technology and understanding this is new for the clients, it's new for us, and really supporting the clients in gaining that technology. We're HIPAA compliant. We have our workspace is a private workspace. We wear the earphones so that we maintain privacy, have a good workspace and still maintain professionalism. That is, if we were meeting them face to face.
Great. And then, Andrea Baskin, you're dealing a lot with families and adolescents and teens. What are some of the best practices that you took?
So definitely, keeping communication open between, especially with the adolescents, with the parents, letting them know what the limits of confidentiality are, expected to, what they can expect about the therapy sessions, about the individual sessions, when they're going to be involved. So very similar to what we're doing normally in the treatment process is having the parents be involved in the progress as well as in the process. So being very transparent about what's going on and being very, just giving them a lot of different times. Also, we have found that scheduling, being able to do sessions at different times has been really good at keeping the parents involved, especially the parents who to work. So all of those things have helped in just keeping the clients engaged in the process.
Got it. Great, great. So want to get into maybe a little bit about, NBH's approach and, how is NBH doing telehealth? So maybe Dr. Balkanski, if you want to talk a little bit about that.
Sure. Well, right now we have a flow. I can say that. Initially, it was not that way. We started off pretty scattered. I think this really hit everybody, unexpectedly. So as of right now, we really put together a nice flow. We really streamlined our 3 platforms into a seamless process, meaning that the admissions team basically schedules an appointment and that automatically gets alerted to the clinician and also to the therapist. So everything is pretty automated. The client gets a link directly to where they got to go to, and the therapist as well has their link directly going to where they have to go to. We wanted to ensure that this was as easy as possible for anybody of any technological position that they may be in. So right now, once we were able to get that down, it really helps the client to just hone down any anxieties or stress they have of using new technologies, and as well as our clinicians. So being better organized was a huge part of how we're doing it. We're trying to streamline as much as possible and automate as much as possible, so that the clinicians also get more time for them to do, work with the clinicians on their one-on-ones.
And then can I just jump in, Eric, and add a little
Absolutely.
bit to that? One thing I think that's important to mention is, these are the MBH practices that have allowed us to be successful. But we understand there's a lot of people out there that might have private practices, or they're, smaller practitioners. One of the exciting repeals on the legislative side that we've seen is almost a total repeal of HIPAA. Now, not that we would advocate for not complying with HIPAA, but using, high-end products like Zoom, they're not really requirements anymore. So we've seen the government and state agencies say you can use FaceTime, you can use WhatsApp, you can use Google Voice, Google Video, all these other platforms that, again, go back to this overarching principle of how do we increase access, especially in a time of need when we know people are struggling. So I think that's been one of the more exciting and positive shifts we've seen come out of this. It kind of gave us a metaphorical kick, about 10 years ahead in the telehealth space. So we've been really, successful at implementing a lot of this technology, but it's not necessarily the standard. We can get away with doing a lot of other creative, using a lot of other creative platforms to provide services and still comply with the law.
Got it. So maybe to help sort of summarize for the viewers out there, I think, some of the ease of previous barriers and restrictions in maybe cross-state, in HIPAA, not being able to use certain platforms, and even some insurance regulations that we'll get through as well, has helped it maybe during this time accelerate access to care, where those individuals who may have been wanting help before, it may have been a little bit more difficult if there wasn't a local facility sort of speaking in their backyard to come in and see a therapist.
Nailed it. Perfect.
All right, great. And then actually for you, Jerry, there's a question out there that someone had asked, can a doctor prescribe medications across state lines via telehealth?
Yeah, so this is something that we're looking at when we look at medication-assisted treatment. Now, we've seen the Ryan Haidt Act, which is really the prohibition on providing, for us in the substance abuse space, certain prescriptions. We've seen that repealed. Now, I would still caution and say that we really want to look at this on a state-by-state basis. Just because, the federal government says one thing and they can repeal act or statutory language, but the states aren't always following. So it's kind of difficult for me to answer that with certainty. I would say let's look at each state is release executive orders specifically for the prescription and the providing of services on a telehealth basis, whether they address cross-state borders or restricting or eliminating restriction of cross-state borders and waivers. We have to look at that kind of on a case-by-case basis.
Got it. So it might be possible, but proceed with caution and do your own due diligence with your legal team.
Right. That's our legal disclaimer.
Perfect advice always. All right, great. Well, thanks for asking the question out there. Want to get to you, Andrea Horwitz, and talk a little bit about the three-phase IM approach that we're using with telehealth and outpatient. And can you maybe talk a little bit about that program?
Sure. So our IAM approach is inception, action, and maintenance. So basically, I'm going to start with our outpatient. We do an initial assessment and treatment planning, and that's done with a licensed therapist. And phase 1 is inception, approximately 90 days. We do 3 weekly group sessions, 1 individual session, and 1 family session. Phase 2 is our action phase, which is about 90 days, 12 weeks. And that's where they're going to get 1 weekly session, individual, 1 group session, and 1 family session a week as needed. And then phase 3 is our maintenance stage, and pretty much that's ongoing. Our PHP works around the same way, but that's 5 hours a day of groups. They get an individual session and also family sessions. And that averages maybe a duration of about like 1 month, depending on necessity. And our intensive outpatient IOP is 3 hours a group a day, 3 days a week. So that's 9 hours a week. They also get an individual session a week and a family session a week. And that can average 2 to 3 months, also depending on necessity.
Great. So I think that's a helpful resource and program for anyone out there that needs it, and very flexible within the 3 phases, and also the higher, more intensive level of cares that's being offered as well. So thank you for that information. I wanted to talk maybe a little bit about adults versus adolescents in telehealth, and what are maybe some of the benefits of telehealth for adults, Andrea Horwitz?
Yeah, so what we're really finding are so many benefits during this time. So it's really giving them like this increased access to getting a therapist, because one of the biggest challenges for a lot of people and the barrier is actually just picking up the phone and making that initial appointment. And now we have this platform where you can get on, you can make your own appointment. You don't have to worry about calling, picking up the phone, waiting in a waiting room, having that anxiety. So it really takes away that barrier, and you're in your own home feeling very comfortable. It also adds additional privacy, because even if you came from a small town or community, you're really avoiding maybe running into a colleague, a friend, somebody you know. In this way, that removes that barrier. Listen, we don't have commutes. There's no longer difficult commutes, having to leave work, worrying about traffic, being anxious, like in the car, trying to get to this appointment. And then, having some part of that appointment just deregulating, escalating yourself, and that you can do it from the comfort of your own home, your workspace, and that eliminates that barrier. And also, it's a really increased access for those that the disabled populations and those with chronic pain. So, if there's not wheelchair access, or somebody's really having a difficult day, it gives them the ability to still have access and availability to their therapist, have the session, again, in the comfort of their own space. And of course, it's increased safety at this time, so it's really respecting, social distancing. It's keeping the client and the therapist safe, and it's still providing like a much needed service.
And then, Andrea, I just want to add on to that. I think all of the benefits you mentioned we're seeing those same benefits not only for the individuals we're providing services for, but for our direct care team. You know, the ability to work from home. Everyone's seeing these stressors from COVID, right? Not just our clients, but also all of our employees, our therapists, everybody on this call right now. So for all the providers that are listening, I think it's important these benefits equally impact us.
Mm-hmm.
So we see them on both ends of the spectrum.
Yes, thank you.
Great. And Andrea Baskin, any benefits that you're seeing specifically for adolescents and maybe their families?
Absolutely. So I agree with Jared and Andrea about all the things that you talked about. It really has provided, doing telehealth has provided more accessibility to the clients, so the adolescents, the parents, to be able to seek out help for their teens. So some of the big benefits that I see for the adolescents is that they're very comfortable with technology. They're all day on their phones, social media, that's how they communicate with their peers, with their friends. Now they're even doing school online. So they're very comfortable with, having a screen in front of them and talking in front of the screen. So I think that's one of the benefits, where they can be kind of in the same setting that they usually are. So it can make it more casual and less formal, to where they're having to go into an office and they could feel like you're in trouble, you're here because there's an issue. It could create more of a less formal kind of setting, where they can just talk to someone and see if they like it. Usually for the first session, we're able to start building a relationship with the client and be able to continue on with their treatment after that. I think that another very positive thing that we're seeing, especially for clients who will go into or have gone through residential treatment, substance abuse treatment, mental health treatment, they can continue their services. They can continue and do their aftercare and continue the recommendations provided. We have seen that in the past, that has been an issue where parents are busy, life gets in the way, they don't have time, and they can't make it to an appointment every week or 2 appointments per week. So now we're going to be able to continue that, to where we're going to be able to have the clients do their aftercare and continue on with their substance abuse and mental health treatment after they're done with substance abuse, with residential treatment at that point. On our end as therapists, I feel like there's also more availability for appointments, for us to be able to see clients earlier in the morning, a 7, 8 o'clock appointment, also a 7, 8 o'clock at night. It's a lot easier to fit people into those times, and also to schedule them short notice. We have many parents that call from one moment to the other, where I have a crisis, I need to speak to you now. Can you fit me in today? In an office setting, it might be a little bit more difficult, but I think that with telehealth, it's a lot easier to just schedule them at any time before the day ends. So I think that's a huge benefit to that.
Great. And then how do you keep them engaged in treatment in their sessions, especially, with the adolescents?
So with the adolescents, we usually encourage them to try out the first session. We let them know, hey, try out the first session, see how you like it, just talk to us for a little bit. It's just a quick chat. We're going to talk for a little bit, nothing too formal. And we find that after they have the first session, we're able to get them engaged, either by trying to see what they like as well. So I know that I was talking to another therapist that works in safe landing as well. She was telling me that she's sending them, the clients, kind of rating scales for their emotional rating scales, where they can engage, and that's a way to keep them engaged, and they can report to what they see. So all of those are ways of being able to keep them engaged, and also having them participate in their own program, being able to reschedule their own appointments, being able to say what day is good for them, not something that's just imposed based on their parents' schedule. So I think that's huge as well, where they have that independence about their own treatment.
I also wanted to add, because I saw that somebody asked, do we see like they're being more compliant with their appointments? And it's a really good point, because they really are. They're so much more engaged. And I really find that they want to come to the appointments. They're looking forward to it week to week, because it's easy. It's not an added stress of having to leave work early or ask for time off. They can do it at their convenience and in the comfort of their own home. So it's not like they're not going to be away from the family for an extra hour. They're going to be right there. And I really find that once they get comfortable at the first session, I could see like it's a little like, what is this about? And after the first session, they're like, let's keep doing this. And they find things to even talk about for the next session. It keeps on bringing up more things. So they're definitely a lot more compliant because you're taking out that barrier of driving and being in an appointment, and it's less, judgmental as well. It's not as formal.
Andrea, how do you manage distractions? I imagine that would be the first thing I would think of if I'm providing group counseling. Cell phones, dogs, parents wanting to eat, all the things that we can control when we're in a room together. And I'm sure you guys have seen that so far. How do you manage those?
Yeah, so thanks. I'm loving all my new little coworkers in my group sessions and in my individual sessions. So it's really about really being flexible at a time like this, right? Because really what we really want to do is to access, especially during this time, to give people this emotional support. And, with some of my suggestions is kind of brainstorming with the client. Where can they go? Where can they go for that hour? So maybe we're going to talk about like a walk-in closet they can walk into for the hour, or they can go to sitting in a car if that's not moving, and helping them brainstorm, or get, thinking about how getting the kids like the tablet for, 45 minutes. But I think it's part of it, the dog barking, the kids going in and out. But, I think as long as we engage them and we show that we're present for them, I think that's what's keeping them in treatment. Because whether they were in face-to-face with me or they're in a telehealth session, we want to engage them and be present. So as long as I'm present, then I can get them present with me.
Yeah, and I would agree with you, Andrea, on that. We're being flexible with the client is extremely important, and normalizing it for them. Normalizing that it's normal. Like, we're all working from home. Kids are around. There's not really maybe a place to escape to for a whole hour, or and giving them maybe ways, like you said, giving them the tablet. We're finding ways with them to where they feel they can continue on. So having our support, I think, in that area, it's important to know that it's okay if your kid comes in screaming and asking you for something. That's normal. This is what we're living now, and we're all we're gonna cope with this, and we're gonna do this together.
And the only other thing I wanted to add that the best part about telehealth therapy is that you can do shorter sessions a little more often. So if you can only get a half an hour in, you could do another half an hour. And that you wouldn't be able to do as much face-to-face, right? Because that would maybe involve getting a babysitter or leaving work again. So this allows for more shorter sessions, and maybe twice a week then. So that really opens up the door for clients to get the support that they need at this time.
Yeah, awesome. So a lot of benefits there. And Andrea, how are you making it feel less uncomfortable maybe for clients, since this is maybe something new for some of them?
Yeah, I think initially they are a little like, not scared, but I don't know what to expect from this, and is it going to be as comfortable? But I think the fact that they can share in their own environment already, as we spoke about, kind of takes that barrier away. I find that clients are a lot more relaxed. We're really there to help them with new technology and accessing, Zoom and having the patience with that. And like Andrea said, there's a lot of compassion that we have at this time, and really the support, and really, confirming that we're glad that they're reaching out and getting the time that they need to take care of themselves, and having compassion. I also that we really respect the client's anxiety as they navigate through this pandemic and through this time. And really our goal is to ally with their anxiety and to really help them cope and maintain, you know, this emotional stability. And to really, when these times are so unsure and where we don't really have a lot of control, that having this continuous, you know, being continuous with this therapeutic relationship is really what I think is important, that shows up at a time like this in crisis, and that's what we're really here for. And so, yes, I think the benefits are going to, and all of that is what happened without a crisis, and just being therapists, that's what we do. But really at a time like this, you know, that's really what the goal is to be there and be stable for them.
Yeah, and I think people are a little more receptive to trying out telehealth now, because, you know, for some states, for many states, even today, being able to go to a provider and travel to is sort of a little bit off limits. So I think on both sides, on both the client side and on maybe even some providers and some therapists, and this is something new for them too, that this all, you know, helped a little bit accelerate at least trying that out. And I think, you know, to our point here, that the clients are a little more receptive to trying telehealth now. And Andrea, in your sessions, do you require your clients to show their face?
On our end, yes, we do require the clients to show their face. And I think Dr. Balkanski can piggyback on that.
Yeah, it's actually one of our best standards and requirements from insurance companies, that initially in the very beginning, they were allowing like phone conversations, but now it has to be a face-to-face in order for us to actually have a mental status assessment and see those, you know, cuties that we would get when we actually see someone. So it's part of our best standards, and, you know, keeping up with the quality of care, that we have to have video conferencing. So answer that.
And Andrea Horwitz, you know, any insight into there, why, you know, from a clinical standpoint, that you might want to have the client show their face on video?
Yeah, sure. So, you know, a lot of times, you know, somebody will say one thing, but their body language will show another thing. So, you know, sometimes clients are like, no, I'm good, I'm fine, I don't even know why you really called. But you can tell through body language that they are anxious. And that gives us a chance to kind of reflect on that, you know, like, I really hear that you're saying that you're okay, but I really see that, you know, your leg is shaking, or you're moving your hands, and, you know, and I'm kind of wondering what's going on. So it gives us a chance to really have open communication. And I think once they can see that we really can read them, and that we're like visually can see that, it really gives us, like Dr. Pansy said, a mental status exam, so that we're able to help them as a whole. And I really haven't found, like, clients have been really open to doing it. You can tell initially sometimes they get they're not quite sure, and then within 5-10 minutes of the session, they tend to relax, and you can see it in their bodies, their faces, and tend to be very open to it.
And the question we have out from one of our viewers, for any one of the Andreas, how to intervene with via telehealth if client is having a crisis or requiring possibly a higher level of care, any procedures, etc.
So on my end, one thing that I have found is having the support from the family. So if I see there is a client in need, there is a crisis, having the parents, usually the parents are around now that everyone is home. So contacting the parents, we usually have the phone number, and we can text them at that moment. If it comes to a point where they are threatening to hurt themselves or hurt somebody else, we would call the police at that point and follow up with the parents so they can keep an eye on them and just stay with them while this happens. If there is a crisis to where they're very anxious and it's not a threat to themselves or others, we try to manage it via Zoom, and then if not, then we have the parents also assist in that. So that would be how we handle it with the adolescents.
Yes, and the adults would be very similar. So I always have emergency support phone number and somebody I can reach. And I always let them know at the initial session that if I feel that they're harmed to themselves or somebody else, I'm a mandated reporter, and that I will report it to their emergency contact, or if needed to call, non-emergency 911. But I also speak to them that, especially at the time of assessment, if I feel like after the assessment they need a higher level of care, that's what I would recommend. So I kind of let them know from the start. But I think the most important thing is, especially in telehealth, is to have an emergency contact number. The most important thing to get prior to starting the session. And that should be done at the initial assessment or when they first call in.
And then one of the things as well, if we're dealing with substance abuse, if we see that the client keeps relapsing, then usually making a plan with the family as to what the recommendation, like Andrea said, what's the recommendation? And on my end, I would start looking for services that would provide a higher level of care for this client based on their insurance and their needs and their location. So that would be, if we're talking about somebody who uses, that would be the plan, to find the resources so that we're ready in case that we need to go ahead and take a step forward and place the client in inpatient treatment. We have options to do that right away.
Great. So family involvement in emergency contexts, especially to have during telehealth. Thanks for giving everyone some perspective into that. Want to talk maybe a little bit about the COVID-19, temporary changes that have, maybe taken place. How is NBH navigating the changes, for last month through May? Any, legal or billing reimbursement changes? Maybe Dr. Balkanski, you can let us know a little bit more about that.
Yeah, from the billing side or the insurance side, insurances were not ready for this initially. When we first started transitioning to telehealth, they had to even update their policies and procedures and kind of get clear on exactly what it is that they require from us. So initially there was really a lot of confusion on exactly what they require. They do require specific documentation. It is quite clear now. You have to explain exactly why you're having the telehealth conference session. Of course, we're having because of the pandemic. We had to get really clear on that. And also like that you do have that video and audio access, that you can see them and that you can have that mental status. So the telehealth session has, also been limited on when it's allowed to be done. We're noticing that more insurances are being accepting of it. Initially, they were not so accepting, and then once they updated their policies and procedures, more insurances became accepting of it. And there's still some hesitation with certain levels of care. So not all insurances are covering like PHP level. Very few are, but majority of them are all accepting of IOP and OP now. So they've been completely on board now, and there are end dates for some. Some of them do like March, and then they extended it to May, and then June. Now we're noticing some of them are extending it to July. So we're just keeping monitor of those dates and when we would have to terminate certain services like those higher levels like IOP or PHP. So then we can, revert back.
I think we've also seen a lot of the insurance companies step up in the way that they look at copays, deductibles, out-of-pockets, patient responsibilities to really encourage the individuals to take advantage of virtual services. That's been pretty significant for us also.
Authorizations have also been waived from some insurances, so we don't even have to do, even for like our detox or high levels of care, they just want to make sure the clients are getting paid. So some of them are just, fast starting it and just saying, yep, notification, you're good, call us back after this many days and just update us. So some insurances have really been pretty good with the whole transition.
And Dr. Balkanski, there's a question from one of our viewers in regards to UR. Are insurance companies going to reduce days per level of care when a client is utilizing telehealth as compared to in-person?
Actually, no, we haven't seen any reduction at all. I would say, if anything, there are more stressors, and the criteria needs have been increased for some clients because they're really, I mean, with everything that's going on, there's higher anxiety. They're trying to put their lessons into practice, and you know, there's just a lot going on. So some clients are even getting more days because of everything that's going on. So I don't see any reduction in the amount of days, if it's the same or slightly increased because of the stressors that are heightening the criteria requirements.
Got it. And you know, maybe for you, Jared, someone else out there asked, you know, do we know until when insurance companies will have in place the waiver to be able to treat cross state lines for telehealth?
Yeah, so this goes back to the regulatory nightmare we're kind of navigating day by day. So starting, CMS is kind of the federal, I would say, guiding point in terms of what we can expect the trend to be. They initially came out March 18th. They said we're going to allow cross-state provision of services for 90 days. About 2 weeks ago, they extended that another 180 days. On the state level, we're seeing the majority of states allowing these you know, the repeal and restrictions for at least another 90 to 180 days. You know, it kind of tells me, I think telehealth services are here to stay. I think we're going to see a kind of a movement into creating an interstate telehealth pact. There was a coalition that was created 5 years ago to allow interstate practice of medicine and counseling services. 2 states had signed up before COVID. Now we have 38 states that are part of it. So while there's not a hard line, 90 days, 180 days, I think the trend is we're going to see this at least till the end of the year.
Great. So longer than, you know, June 1st or July 1st, you think that some are right now updating us on, right?
Yeah, and I think, like Dr. Balkanski said, is the insurance companies were not ready. The states weren't ready. Really, none of us were ready. But suffice it to say that I've never received so many emails in my inbox from Blue Cross, from Aetna, from Cigna, from all the other payers. So they're doing a really good job at communicating and keeping all of the providers and their constituents and their clients in the loop. So I think we just need to stay up to date on the regulatory changes. But I do think this will be here for quite some time.
Got it. So more emails from Blue Cross. Are the wait lines shorter when calling in now?
Blue Cross, I have to get back to you on that. Depends on the day that you're calling and the time. It really does.
Avoid Sundays.
avoid the morning. Yeah, some insurances actually they're taking a hit. There's some that are really behind. Even staff wise, you have to think that they're like any company right now. You know, they took a hit staff wise, understaffed, or whatever it may be. And that was another reason for the quick auths too. No authorizations, that they just require notifications.
Great. So I think heading towards the right direction, maybe.
Yeah. To add to Jared's thing, telehealth is definitely here to stay. I do believe that based on the trends that we're seeing right now. I mean, we already had a facility and location fully doing telehealth for outpatient. We attempted IOP prior COVID, and we were successful with it. But billing wise, you know, we weren't. IOP was still really at that gray line of acceptance. I would say now because of COVID, that IOP is much more accepted, and I do think it's going to be more accepted. Partial hospitalization program is the one that I you know, they're really struggling with because it is a more acute level. There is a partial hospitalization component that does require some, you know, form of medical monitoring in it. So I don't see that long term, but IOP and OP, I do agree with Jared that it's here to stay, especially OP.
Great, got it. Another question someone out there had, do you think that insurance companies are going to start requiring telehealth attempts prior to inpatient treatment, similar to Kaiser requiring outpatient attempts prior to doing residential?
I actually have not heard anything like of that. Of course, you do have to do an assessment prior to admission. So that is a requirement. It's actually would be a good idea if, now that we do have telehealth, that we do that assessment evaluation before they admit. And that's actually a very good point brought up, but I don't see it being required. For good practices to make sure, especially clients are coming into your inpatient, I think it may be a good route to go actually.
Mm-hmm. All right, great. Well, hopefully that helped answer that for you out there. Want to maybe jump forward into a little bit of the future and have some discussion around maybe the future of telehealth. I know we touched upon it, but maybe what is the future of telehealth, and how does NBH tend to handle that?
Well, initially we really struggled with how to handle it, meaning that it was like a lot of technology all at once. I mean, everybody, again, like the Andrea's even said, like working from home challenges, and then, learning technology. I mean, I would say at the beginning when we first started, like everybody's range of technology was like very broad, and everybody learned it super fast. And I would say that we really narrowed that gap, and everybody really is like tech savvy now. Like they've learned the platforms, they're learning new technologies on how to get better. And I would say our staff and everybody has handled the rapid change really good. And I think it's just going to make us better as a whole in a company, and also our productivity long term.
Great, got it. So telehealth is here to stay at NBH, complementary to the higher levels of care and some of the face-to-face that we do. Andrea Horwitz, is there maybe room for a hybrid approach?
Yes, I think it's going to be like amazing, because I think it's going to give the flexibility of like having to come in, be able to do groups, and maybe doing the one-on-one through telehealth. So it's really going to allow a lot of flexibility. And I think, as far as even in relating it to substance abuse, like a lot less excuses. So that I can't make it because I have to work, or because I have to go home and take care of the kids, and then my wife has to work, all these things, these barriers that can come up, and they're real barriers. But it's going to really allow them to have their recovery and be able to integrate back to their day-to-day life. And I think we're going to really see this as we start to integrate back into whatever the new normal is. And I think there's just, it's going to just give us so much more flexibility to provide the service and to give the care that we're giving. Because we're going to do the same amount of care that we gave face-to-face and through telehealth. And it will just allow for like a greater spectrum of, times and availability. And like Andrea said, like we can now do sessions at night and still do it from our own home and not have to worry about somebody in the office for an extra 4 or 5 hours. Like we can go home and still have a session later at night. So I think it's going to be very helpful and really engage clients even more.
Great. So stuck in traffic, can't make it, might not be an excuse any longer.
Yeah, it's just going to take away those barriers. It's just going to allow them more flexibility. I think a little more emotional flexibility, and I think a little more, and take away some of the barriers that can possibly come up for them. And they can continue treatment.
Yeah, question someone had asked her, Denise here mentioned she's seeing clients she's seeing clients at the facility in person, also participating in telehealth by choice on different days. Do you see any issues with this clinically or with the payers? So I think talking about our hybrid approach, that is something that we are continuing and looking forward to doing.
And also, you know, the insurances are not too clear on this as well. Like, they're very clear on the IOP and OP in telehealth services. So it definitely depends on the services, of course, like that we're referring to as hybrid. The therapeutic service, continuing the hybrid, you know, it shouldn't be an issue. Of course, like the nursing component, you know, we need that physical examination, or even a doctor visit, you know, an HEP, being able to actually see and physically do that physical exam or vitals or whatever it may be.
Great. Another question that we're coming towards the end of our session here, and a lot of questions are coming in. Someone asked there, how are you handling drug testing with telehealth services?
Yeah, right now we send them to an external lab for, especially if they're unable to come to us, and because we do have facilities that are open for the inpatient. We, of course, like, you know, Jared may have touched upon it, like we practice, you know, we have protocols and policies and procedures to assure that we're keeping up with the standards, and, you know, everybody's protected, but we do still have that component. But if they're in our outpatient, we send them to an external lab.
Got it. Okay. And another one out there, another question, Zoom meetings, are they recorded, or sessions being recorded?
No, they're not being recorded.
No, it's the same policy that you would have face-to-face. So the only way you could record a client is if you had a consent to do that. So it would work the same way for telehealth. You would need a consent.
Mm-hmm.
Oh, makes sense there. Another question, as a nationwide company, how are you planning on harnessing the many different therapists and counselors to find the best fit for clients?
So for me, I'll jump in, because I think this is part of the excitement that we've seen in allowing the provision of services across state lines, right? We can utilize our network of experts, and we have someone that's very good with trauma in state A. We have a client in state B that's suffering from trauma. Now that therapist can provide services for them. So as a company, we're able to provide services now in 39 states. That's 78% of the country. We can utilize our resource of experts, of leading providers, psychiatrists, doctors, therapists, dietitians, whatever they may be, to go just beyond their geographic, you know, immediate geographic range, and reach out to these individuals that are needing specialized treatment and help.
Yeah, and to even add to that, you know, our admissions team, they know kind of who's what, you know, has like what niche or specialty. Like, I mean, even Andrea Baskin's, like, she speaks Spanish. So of course, if we have a client that you know, needs a Spanish speaker, then we have therapists that can offer that. So we kind of know who is specialized or has an extra skill that we can really use as an asset to serve the client.
Got it. So a lot of availability to sort of have a therapist that specializes in one area to really be available almost in all states virtually. So I think that's some great benefits overall, you know, for many clients, and goes to the initial point we were discussing, that access to care, right? Increases access to care. Someone else had asked out there, what kind of liability issues are you concerned with for telehealth outpatient services compared to in-person?
Yeah, so my first thought here would be the preservation of confidentiality. That would be the pinnacle of my concern. So what I say is a therapeutic relationship really starts before we enter that Zoom or that virtual room. It starts with the consents. It starts with the explanation of rules, that, you know, we're going to require you to wear headphones instead of be on a speaker in case a roommate walks in or family member walks in. And those are things that probably the two Andreas can touch on, but I think ensuring that we're preserving confidentiality and we're explaining to the clients before we enter the room what the rules are, what the procedures are, what's tolerable, what's not, and we have really good consents that inform the client this is a telehealth service and this is how we're providing it. These are the expectations of us and the expectations that you will have for receiving care.
Got it. Okay, great. So hopefully that helps out there for that question. And coming up towards the end, want to close out with maybe the last question here. Someone had asked, have you been able to see any noticeable difference in outcomes compared to telehealth and traditional in-person? I think it might be a little too soon to see outcomes, but maybe we can discuss a little bit. Do we think it's going to be any different in the outcomes?
And I can touch on that. I have, on my end, I have received positive feedback from the clients themselves saying that they have found it beneficial, they have found it helpful, they're implementing the strategies, the skills, or the things that we're talking about in the session, and they have provided very good feedback. So I think that a lot of researchers also found that telehealth sessions are as effective and beneficial as they would be face-to-face. So I think that, like you said, we are, this is something that we started not too long ago, but I do believe that that it's very similar to face-to-face.
Yeah, I agree with Andrea, and I think both of us run groups, during the week. So Andrea runs like a family support group, and I'm running also a support group that anybody can join. And through that and the individual therapy, I'm finding them so much more engaged and willing to continue the process and being able to talk. So I was very pleasantly surprised, and I'm really thinking it's going to be such a great asset, even when all of this, is done. But I think it's now I think it's really the silver lining now to treatment and to individual therapy and for treatment, and giving everybody a lot more access to mental health therapy.
All right. Awesome. Well, thank you everyone for joining. Want to let you all there know that Niznik Behavioral Health wants to be a resource for you. We're going to follow up in the email with the recording of this. In the follow-up email, we'll send you some information on all the technologies we're using, the Opus EMR that has helped us streamline some of the video conferencing tools that we've been using, the scheduling tools, how that all integrates. And if you're a client or a therapist out there, feel free to use this as a resource. There might be a state that you can't service that one of our great therapists can help you out with. There might be a case that you're not comfortable with, and vice versa. I want to encourage everyone to reach out. We really want to be support for everyone on all fronts. So thank you again, and we'll look forward to the next one, and maybe it'll be sometime upcoming next month. So thank you all.
Thank you.
Thank you.